IBS, conquer your digestive demons and reclaim your life. Irritable bowel syndrome, IBS, is a common gastrointestinal disorder that affects the large intestine, colon. It is characterized by symptoms such as abdominal pain, bloating, changes in bowel habits, and discomfort. While the exact cause of IBS is unknown, it is believed to involve a combination of factors, including abnormal muscle contractions in the intestine, heightened sensitivity to pain, inflammation, and changes in gut bacteria. In this article, we will discuss various strategies for managing IBS symptoms and enhancing the quality of life for individuals living with this condition. Understanding IBS symptoms. The symptoms of IBS can vary widely between individuals, making it a challenging condition to diagnose and manage effectively. Common symptoms include A. Abdominal pain or cramping. This may range from mild to severe and is often relieved by passing stool or gas. B. Bloating and gas. Excessive gas production and a feeling of abdominal distension are frequent complaints. C. Diarrhea. Frequent loose stools may occur in some individuals. D. Constipation. Difficulty passing stools or infrequent bowel movements may be experienced by others. E. Alternating bowel habits. Fluctuations between constipation and diarrhea are common in some cases. F. Mucus in the stool. Some individuals may notice the presence of mucus in their stool. Lifestyle modifications. A. Dietary changes. Identifying and avoiding trigger foods that exacerbate IBS symptoms can be helpful. Common triggers include spicy foods, fatty foods, caffeine, alcohol, artificial sweeteners, and gas-producing foods like beans and cabbage. A food diary can help identify individual triggers. B. Fiber intake. Gradually increasing dietary fiber, especially soluble fiber, can improve symptoms of constipation. However, in some individuals, high-fiber diets may worsen symptoms, so it's essential to find the right balance. C. Regular meals and chewing thoroughly. Eating at regular intervals and chewing food slowly and thoroughly can aid digestion and reduce symptoms. D. Adequate hydration. Staying hydrated by drinking enough water throughout the day can help maintain healthy bowel movements. E. Stress management. Stress and anxiety can trigger or worsen IBS symptoms. Engaging in stress-reducing activities like exercise, meditation, and deep breathing exercises can be beneficial. Medications. A. Over-the-counter remedies. Antidiarrheal medications, loperamide, can help control diarrhea, while laxatives, polyethylene glycol, can relieve constipation. However, these should be used under medical supervision. B. Prescription medications. Depending on the predominant symptoms, a healthcare provider may prescribe medications such as antispasmodics, tricyclic antidepressants, or selective serotonin reuptake inhibitors, SSRIs, to alleviate pain, cramping, and regulate bowel movements. These medications should be taken as directed by a healthcare professional. Alternative therapies. A. Probiotics. Certain strains of probiotics may help restore the balance of gut bacteria and reduce symptoms. However, it's essential to choose probiotic supplements wisely and consult with a healthcare provider. B. Herbal remedies. Some herbal remedies like peppermint oil, chamomile, and ginger have shown promise in relieving IBS symptoms. However, further research is needed to establish their efficacy and safety. C. Mind-body therapies. Techniques like cognitive behavioral therapy, CBT, hypnotherapy, and relaxation exercises can help manage stress and improve overall well-being. Seeking professional support. A. Consultation with a healthcare provider. If you suspect you have IBS, it's important to seek medical advice for an accurate diagnosis and to rule out other conditions. A healthcare provider can help develop a personalized management plan. B. Working with a dietitian. A registered dietitian can provide guidance on dietary modifications, recommend suitable meal plans, and help identify trigger foods. C. Psychological support. Living with IBS can be challenging, and individuals may benefit from therapy or support groups to manage the emotional impact of the condition. IBS subtypes. IBS is categorized into subtypes based on the predominant bowel habits experienced by individuals. A. IBS with constipation, IBS-C. This subtype is characterized by infrequent bowel movements and hard stools. B. IBS with diarrhea, IBS-D. Individuals with this subtype experience frequent loose stools and urgency. C. Mixed IBS, IBS-M. This subtype involves a combination of constipation and diarrhea. D. Unsubtyped IBS, IBS-U. Some individuals may not fit into the specific subtypes but still exhibit IBS symptoms. Triggers and flare-ups. IBS symptoms can be triggered or worsened by various factors, including A. Food triggers. Certain foods like dairy products, gluten, high-fat foods, and artificial sweeteners may exacerbate symptoms in some individuals. B. Stress and anxiety. Emotional distress can significantly impact IBS symptoms, leading to flare-ups. C. Hormonal changes. Many women experience fluctuations in symptoms during their menstrual cycles. D. Medications. Certain medications, such as antibiotics or nonsteroidal anti-inflammatory drugs, NSAIDs, can trigger or worsen symptoms. Diagnostic process. Diagnosing IBS involves a comprehensive evaluation, including A. Medical history. A healthcare provider will review your symptoms and medical history to rule out other gastrointestinal conditions. B. Physical examination. A physical examination may be conducted to check for any signs of underlying conditions. C. Diagnostic tests. In some cases, additional tests like blood tests, stool tests, colonoscopy, or imaging studies may be ordered to rule out other conditions or confirm the diagnosis. Coexisting conditions. IBS often coexists with other medical conditions, including A. Fibromyalgia. Many individuals with IBS also experience widespread musculoskeletal pain and tenderness. B. Chronic fatigue syndrome, CFS. There is an overlap between IBS and CFS, with many individuals experiencing both conditions. C. Anxiety and depression. Mental health disorders, particularly anxiety and depression, are commonly seen in individuals with IBS. Long-term outlook. IBS is a chronic condition, but it does not increase the risk of developing more serious gastrointestinal conditions, such as inflammatory bowel disease or colorectal cancer. While symptoms may fluctuate over time, many individuals find effective management strategies that allow them to lead fulfilling lives with minimal disruption.